Let's talk about preventing diastasis or ab separation during pregnancy. Hi, I'm Kayla. I'm a pelvic floor physical therapist who helps women through pregnancy and postpartum every day. When you're pregnant, it is completely normal for your abs to separate. I think that's the first myth that I hear a lot is people are like, I want to prevent it from happening or I don't want it to happen at all. But if you make it to the end of your third trimester, you're just going to have some ab separation based on what's normal in our bodies. As your baby gets bigger, those muscles have to lengthen and separate a little bit to make room for your baby. One thing you can do though is you can limit the amount of separation by doing some strategic exercises and breathing drills during pregnancy. When the separation happens, it happens here in this middle part of your belly. So if you have really tight outer abs, that can create extra pulling and make it so that middle portion separates a little bit more. It's a little bit wider, it's potentially a little bit deeper. If we can release some of the tension in your outer abs, that can take the stress off this middle part of your belly and make it so your diastasis isn't as severe. We're gonna try a breathing exercise to make that happen. So what you're gonna do is while you're sitting or standing, you're gonna tip off to the side and you're gonna put your hand along your rib cage on this side that you're tipping away from. Then you're gonna breathe in, and as you breathe in, you're gonna try to expand your rib cage away from you, so pushing out into your hand like this. And then as you breathe out, your ribs come back towards you. That stretch that you get on your breath in as your ribs move off to the side helps decrease tension in these outer abs. Another thing you can do is a little bit of hands-on massage or something we call skin rolling, which is just where you pinch the skin on your outer abs and you roll it between your fingers like this. Or you could press, and if you find any tender spots, just gently massaging along those areas. All of that is gonna decrease tension out here, it's gonna decrease pulling in this middle part, and it's gonna make it so your diastasis isn't as severe and your postpartum healing is just a little bit easier. Make sure you follow along for more pregnancy tips and tricks.